Hello, my name is Leonie Rastas and I'm the founder of Caesar Care New Beginnings. I started my business back in 2018. It was really born out of my own experience of birth trauma and PTSD. I wanted to be able to help women, to empower them to seek help if they need it, and also to understand the importance of good management of their wound and their recovery. After my birth, which was complicated by failed anaesthetic, I actually felt all the cutting and sewing and pulling, and I was actually not in a good way for some time after that birth. And I had all of the symptoms of PTSD, anxiety, hyperarousal, hypervigilance. I used to be checking the children's if they were breathing overnight. It was just a really, really difficult time. And I felt so alone, and I didn't really have words for what was happening to me, because really PTSD was only named in the early 80s, and it was not usually something that you would expect to happen at birth. So for a long time I really struggled, and one of the problems I had was the dentist couldn't anaesthetize my gum because I had developed a phobia or a mistrust of anaesthetics. So that challenge was really difficult at the time, and the solution I found was in a couple of sessions of hypnosis, just to be able to go back and reframe that experience. So I've always been acutely aware of women who have traumatic births and had great empathy for them. But it wasn't until 2018 that I really felt led to begin the journey of being more of an advocate for women, and to raise awareness of the gaps in the knowledge. So that's where Caesar Care came from. And my first resource that I created was a wound splint. I called it the surgical aftercare splint, and that's a device designed and accredited by the Therapeutic Goods Administration in Australia as a medical device for support. But that was just to really alert women to the need to really support that wound during any sudden movements, such as coughing, sneezing, and even laughing can be really painful. So that was where the business began. And so I developed the splint, which was shortlisted for an award, an innovation award, at the Australian Healthcare Week in Sydney in 2019. Following that, I was invited to go to London to the International Maternity Expo, where I presented the splint and discussed the need for that, and then encouraged the midwives there to remember to teach about wound support. And that's where I met the co-author of a book that I later wrote. So during COVID, it took us 2 years, a midwife from the UK and myself, we put together the C-section recovery manual, which is a fantastic resource for women and their partners and families for that matter, because it goes into, there's 12 chapters of education about caesarean birth, then it goes into checklists for the 6 weeks recovery period, and also some blank journal pages for women to be able to record their journey. So that's really how the background to the business, and I guess it's pretty clear that that came out of my own suffering and my own lack of knowledge at the time when I had my first cesarean birth. So it's all about, for me, it's all about helping equip and resource women and families with evidence-based practice, the best care for themselves, empowering them to know how to look after their wound and how to have the best possible recovery. Now, the skills that I bring to the business come from my own experience, both as a professional, a midwife, a nurse, and an author, and a wife and mother. So, who has had those experiences and has had to research and find out what is the best practice. And my vision for the future is that all women will have access to antenatal information, postnatal information, and referral and support after cesarean birth. The other thing that I think is really important is to raise awareness, to improve access to education for women, and to encourage antenatal educators to include this information in the antenatal classes. I absolutely love seeing the results of women and men, for that matter, after surgery, feeling supported in their recovery, and just hearing the feedback from people who have had their trauma healed. And that is the other skill that I bring to the business, is trauma therapy. So recently I have studied a methodology of trauma therapy, which is incredibly effective and very safe. And the good thing is it doesn't re-traumatize. And that has been, I guess, probably the biggest catalyst in my growing the business, is to be able to reach people, to be able to see the transformation after their trauma therapy. So that's, in a nutshell, how my business came about, and I would love to be able to work with you. If you have any questions, please contact, book a call, and we can chat. Okay, bye for now.